to get a report out from our healthcare systems and what's going on. We're changing the format a little bit this week where we will, I'll run through the dashboard quickly, and then we'll get color from public health and hospital and little boots on the ground. And then our featured guest this week is from Cheyenne Mountain Software. They have the Mission Control app, which is helping with the patient transfers and understanding that situation. Just a couple details before we get started. You can sign up to get an email of this every week. covid.ks.gov/report-outs. You can sign up and get this call and the dashboard sent to your email so you can look at it whenever you want. That's covid.ks.gov/report-outs. Also, if you have questions or things you want us to talk about next week, let us know. ksregionalreport@gmail.com. You email us, we'll try and work it into the next call. ksregionalreport@gmail.com. I'll launch in here to sharing what we got here. Okay, so now if someone, DD or someone can tell me if you can't see the screen, let me know, but I believe I have the dashboard pulled up. Is that correct? Okay, so we'll go through this. So this is the dashboard that's emailed to you. It starts with the hospital numbers along the top. We have 100% of the 31 hospitals in our South Central region. They all reported in. A real important one to look at is percent of these hospitals that are anticipating staffing shortages this week. This is, remember last week we talked about the pinch point for our hospital system generally being staff, space, or stuff. Staff is at the top of that list for everybody right now. You can see 52%, over half the hospitals in the region anticipating staffing shortages this week. And then you can go through, you can get the different kind of patients that are in the hospital, and then the ICU beds and ventilator capacity. I really want to thank the Hospital Association for putting this together every week. We're very, very grateful that they take the time and resources to do this. We know everybody's busy. Here's the number, one of the first numbers I look at every time I get this. You can see the percent of adult staffed ICU beds. So an unstaffed ICU bed's just a bed, as they say. And so that's why it's important to know that there's people who are trained that can staff the ICU bed. We're down to 12% in our region. And that's below where we are in the state. So that's a really important number to look at. And I'm sure the hospitals will come back to that. Plenty of ventilators available, which is good, but we do have 41 patients. Now, I will also say this is a snapshot from yesterday. These move through the day, these numbers. Hospitals are a dynamic environment with people moving in and out of ICUs and being released. And it's just very dynamic, but we wanted to at least give everybody a snapshot every week. And then right here, you can see where our new case numbers are as a region. So this is our South Central region. You can see the spike that came earlier in November. And now we're starting to feel a little relief on the local numbers here. Certainly not breathing room relief where we can get back to where we were. But this is hopefully a sign that people are doing what they can individually that also then impacts the community spread. And so this is a number we'll be watching closely to see what happens post-Christmas as people are gathering together to celebrate the holidays this time of year. And then here on the second page, you can see the different counties that are in our region and the number of people who have tested positive as a percent of the population. And then, where are ICU beds? Not all the ICU beds are being filled with COVID patients. There's always a need for ICU beds for non-COVID. And so you can kind of see how that flows. But this dashboard will be emailed out with following this to your email box if you can sign up. And now let me pass it over to Seth to give us any kind of public health color around some of these numbers.
Yeah, absolutely, John. I don't have a lot to report out today. We are seeing a slightly, as you showed in the matrix, a slight downcrease, but it's better than we were a month ago, but we're still almost double the number of cases that we had 2 months ago. So obviously, we want to continue to see those cases go down. As reported this week in South Central Kansas, we actually only have 2 counties that are under that 10% positive testing rating. So and then those 2 counties are still between the 5 to 10. So obviously, we'd like to see everybody down as low as possible. Best case scenario, until this is just completely gone, would be under that 5% mark. would kind of really allow us to fully open across all levels of the economy, sporting events, those types of opening matrices, if we look at
Seth,
that.
do you have any background on why that 5% number was selected, or what's significant about that? We got some questions about that last week.
Yeah, so I know for a lot of people, specifically like long-term care, the CMS guidelines, so for Medicare, Medicaid, those types of things, that's the kind of the breakdown, 5, 10, and 15, or I'm sorry, under 5, 5 to 10, and then above 10. So I think they're just good round numbers. Science-wise, they may be closer to 4.6%. We see this amount of decrease, but just for an easy general awareness, those amounts have been selected. And I think that, again, with all of our counties above 10%, we're just not really able to kind of fully open. And I think we're seeing that with schools going virtually, some at all different levels, not only elementary, middle school, and high school, but also the colleges. So again, I think those were just easy numbers that made sense from a scientific standpoint when it came to rounding, and then that's what we've stuck with.
Anything else you'd like to add?
Nope, I don't think so. I think there's a lot of other good information on the agenda today, so I don't want to take any more time because I want to make sure we get to those.
Thank you, Seth. And I'll just add, if you're looking for a place to get tested, there's a website, gogettested.com/Kansas. And it has where the testing sites are in this region. You can click on it and find how that's working. So gogettested.com/Kansas, obviously identifying where things are at. And the earlier, the better as far as controlling the spread of this virus.
And John, just real quick, I think we're probably going to get some questions. What about vaccine? I think we'll definitely have more information next week from a public health perspective to report about vaccine, where it's at in the state of Kansas.
Thank you, Seth. And yeah, I was I'll back you up on that. There won't be a whole lot else about vaccine on this particular call. It will be coming in the next week or 2-3 weeks as we understand how the flow of vaccines are going to come into Kansas and how they'll be distributed. So that's all still being figured out. Thank you, Seth, for pointing that out. Now let me pass it over to Dee Dee. Dee Dee, can you make sure you introduce yourself to everybody and give us a sense of what's going on in the hospitals?
Thank you, John. I'm Dee Dee Duell, and I'm with Ascension Via Christi. My general role is in outreach, and for the purposes of this group, I'm kind of serving as a regional coordinator to kind of pull information and speakers and presenters together for some of these. So I appreciate the opportunity today to add a little bit of depth behind some of those dashboard numbers that John shared earlier. And I was able, it was very nice. I had a few hospitals that were really happy to provide some key points from their communities, so it's helpful. So I'm going to be sharing a few bullet points from a couple of our smaller rural hospital communities, as well as Hutchinson Regional Health Center.
And Dee Dee, you're fighting a little bit of a background noise. I don't know if there's a heater on behind you or anything like that, but I can hear you, but if you just want to make sure you speak up while you're going.
Okay, I'll sure do that. So really from a small rural hospital perspective, it's interesting to kind of compare communities. In one of the small hospitals, I would say equally, they're both dealing with being able to provide care to a number of COVID patients that they are able to handle there. And that is despite, space and people resources that they're a little bit limited on. And so both of them are doing that. They have a capacity to do so. And their testing rates, of course, their positivity rates are up, and as more people are being tested there. And one of the hospitals actually said they have a census of 10 patients there, and half of those patients are COVID patients at this time. And both of them, it was interesting to see the different challenges with staffing from one community. They are actually blessed right now that they don't have very many staffing challenges. They've had very few staff who have been out sick with COVID. So their staffing seems to be fine, whereas another small community is really challenged with staffing right now, just due to turnover, staff who prefer not to be on the front lines with COVID, people not really changing jobs right now during the pandemic.
Yeah, and Dee, I might make the point, there were staffing shortages pre-COVID in a lot of these rural markets in particular. And so this has only exacerbated that issue.
That is a very valid point. And so a lot of them are trying to find staffing and plugging in contract staffing if they can find it available. One thing that was common between these two small communities is they both have seen success, and I'm not going to be able to say this word, so I call it BAM. Both of these communities have seen some success with administering the BAM, I call it infusions, in an outpatient treatment room that they can administer. And those are for patients who have COVID, but they have kind of a likelihood to maybe progress toward hospitalization. And this is an effort to try to mitigate that and to keep them from progressing toward hospitalization. Both of these communities have had good success and have indicated that they've been able to prevent those patients from being hospitalized. So I thought that was kind of a neat point to make. Both of them are thrilled that they have received their first round of vaccines and have given them all out, and looking forward to the second distribution to come. Now, I also spoke with the CEO, Ken Johnson at Hutchinson Regional Medical Center. And of course, they are really heavy hit at this time in the pandemic. And, they've got a census, I think he said, of 71. 29 of those are actually COVID positive patients there. And out of those 29, 3 of them are on vents, and then 19 others are on some other kind of form of mechanical breathing devices. This will speak to the staffing situation, and they have 18 available ICU beds, but they're only able to staff 12 of those. And of course, that just leads further into the staffing challenges. They said they had 32 of their employees who were out sick right now, and 28 of those had tested positive with COVID. So that just further lends itself to the difficulty there. Their elective surgeries, they have to continue to limit those because of a lack of staffed beds that they have available to have overnight admissions. And you can see how all this kind of trickles down due to the staffing challenges they have. On a positive note, they said they received their first distribution of vaccinations, and they were happy to report that they were able to vaccine 250 staff and physicians last week. So that was great.
And I'll make this point just real quick, and before you introduce your guest for the boots on the ground, is the vaccination process with the Pfizer vaccine. As you get the booster, then 3 weeks later you get the second shot, and then it takes about 2 weeks before you're considered immunized. And I believe with the second Moderna, if I'm remembering right, is four weeks between the two shots. So it's a 5 to 6 week process from the time these go out before people are considered immunized. And so that though it's great that these are going out, and I know have been a real injection of hope for people, it's important just for the public to understand the staffing issues really probably may not get better for another month to 2 months based on that. And then if you can introduce your special guest for us too.
Yes, I will do that. We wanted to, of course, give you a little bit of a perspective from boots on the ground and trying to get that from different flavors, different communities, different sizes. And so today I have with us Dr. Sam Antonio. He's our Chief Clinical Officer for Ascension Via Christi. And I will just turn it over to him to share some of his boots on the ground perspective and any other comments he'd like to share.
Thank you, Dee Dee. I hope you guys can hear me okay.
Yes.
And thank you for inviting me here this afternoon. So we've had a very exciting week last week because I will start with that, which is the news about the vaccination for our frontline staff. Last Monday, we actually gave the first dose in Kansas for our ICU. Started out with one of our ICU nurses. And we're grateful and blessed to have been in that position. And hopefully we will continue to be able to vaccinate all of our frontline staff who there's still some who are not and we're waiting for additional allocations to be able to do that. And as far as the COVID-19 activity in our hospitals, I would say over the last couple of weeks, we've been, we fluctuate obviously every day. We've been hovering anywhere between 120 to 140 patients. Even though that's a high mark, that really is a lot of patients in the hospital and that we have, it's actually not as bad as it could have been, or as worse as it could have been, if we had continued on the trajectory that started back in October into November. So it's a high number of patients, and we're still very busy, and we still, are trying to deal with staffing issues every day. But the encouraging part about it is the fact that it hasn't really continued to double at the same trajectory that it was headed towards right before Thanksgiving. As far as the Thanksgiving numbers themselves, we can't really say that we saw a significant surge as a result. However, just over the last couple of days, we're seeing a few more patients show up to our EDs. I'll be honest, it's very premature to judge whether that's a true rise that's starting or it's, again, part of that same fluctuation that we have been seeing. So it's a little bit too premature to judge on that. It's just something I've noticed. But the staff morale has improved significantly because of the availability of vaccine, at least for those high risk priority areas, such as our ICUs who are taking care of COVID-19, our EDs, urgent cares. And again, we're grateful and blessed that that's here. We're trying to encourage people to not be concerned with the vaccine as we've judged it to be a fairly safe vaccine. I did want to mention, again, to your point earlier about how a vaccination works, two things to remember. Despite the fact that healthcare facilities have started to vaccinate, that still represents barely a fraction of the population. And so there's really not still widespread immunity. And also it takes time for immunity to build up because it's a first dose followed by a second booster dose. And the reason I mention these 2 points is because it still is important to continue to do the same things that's been advocated before to avoid crowding, practice social distancing, to wear a mask, wash hands. Just because a vaccine has been introduced to a small fraction of the population doesn't mean that now we don't have to take any additional precautions. It will be several months before there is really good sense of what's going on with the COVID-19 pandemic in our communities. And then it's when we start the conversations about kind of potentially changing some of the public health recommendations that's been out there. Thank you.
Thank you, Dr. Antonios. We appreciate your time. I know you've been putting a lot of effort out there and doing a good job communicating. And what happens is, even as we maybe plateau here and they're able to cycle some patients out, there is demand out there in rural Kansas to get to centers like Wichita or Kansas City, where they have more tools and more expertise with the more severe cases get. And that's why we've asked our friends from Cheyenne Mountain Software, who have the Mission Control app that really is kind of the center of how patients are transferred. They have some dashboards they're going to put up and share with us to give us a picture of what the transfer situation's like in our state. Dr. Watson.
Yeah, great, thanks. And Dr. Richard Watson practiced in state of Kansas for a number of years. One of the founders of Cheyenne Mountain Software. Our software tool helps connect senders and receivers and transporters together. It takes the workload off of the sending facility so that we help arrange for the transfer as well as help with finding appropriate bed placement. We were brought on board by the state of Kansas as some of the smaller hospitals were having to make 10, 15, 20 calls to find a bed, oftentimes in different states. And because of workforce issues, they could not afford to do that over and over and over again. And so we've been tracking bed availability as well as just the ability to move patients from one place to another. And we're on our way to being available to every hospital in the state by the end of the year. So first graph that we're going to look at is just the very typical state numbers, and I want to introduce you just the way we look at the picture in.
Sorry to interrupt. If I could be made a presenter, I'll share my screen out to show some of these visuals.
And I don't think I have that ability. I'm not sure.
Megan just gave it to you, Jesse. Thank you.
Thank you.
So this is data that's pulled in on the Monday, Wednesday, Friday, and it's just we've reformatted to a way that we follow. Blue is positive cases, red becomes the hospitalizations, and black, obviously, the deaths. And I think, we see undulations. Everybody can make any plateau or any lessening of the effect, whatever they want to look at here. But in reality, we're pretty much the same as we've been over the last couple of months, and the November timeframe, December timeframe looks very similar, and difficult to say much more than that statistically, certainly. Next one, we check bed availability, not from the need to have exact numbers. We're very pragmatic in what we're doing. We have a group of communicators that are constantly working with facilities in even a 4 or 5 state region to be able to follow just roughly the number of beds. What we're trying to do is cut down on the number of calls that we have to make in order to secure placement. So we will sometimes have to make 10, 15, 20 calls to find bed availability. There have been times where we've had no beds available in Kansas, and certainly working with Nebraska, have been in contact with their one call center, Oklahoma, Missouri, Colorado, Texas at times. We've seen times when we've had 3 and 4 states requesting beds for capacity. So we work with tier 1s and tier 2s. Tier 1s are traditional receivers. Tier 2s are non-traditional receivers. So we're trying to access every bed that's available in the state, both to move patients up the scale of acuity and then repatriate them back to their home hospital when it's possible. So we're using the network that we've formed, as well as our ability to communicate with vendors and to move patients. Go to the next one, Jesse, and if you'd like to kind of walk through what we're showing here.
Yeah, so this is a real-time snapshot of the data we're collecting through Mission Control, and we're able to assess in this view here a 30-day snapshot of the number of transfers. We've got some statistics here regarding the number of COVID presumed patients that we're moving, and just below 40%, as well as the number of facilities that are requesting assistance locating a receiving facility. So we're seeing that roughly 35% of the transfers are requesting that they can get some assistance in locating a facility. If we make this COVID positive only, you'll see that jumps to 60% nearly requesting assistance locating a receiving facility. So partnering obviously with all the facilities in the state is critical, and we want to make sure we continue to establish clear lines of communication and partnership to help facilitate the movement of these patients. The other thing we're able to track is times. So if I say, yes, we want to look at requests to help with bed availability, you'll see this time for a crew to arrive at the sender jumps significantly. So we go from a median of 1 hour 18 up to 2.5 hours. And then if you expand that further, you can really see the impact that we have across the system on general bed availability, time critical. Again, those diagnoses that really have a time sensitive clinical element also affected by that. We can pull out an individual transfer here as an example that it just highlights some of the issues within the system. This one GI bleed and this respiratory transfer, there's a median time of over 5.5 hours for waiting for transfer for that patient. And that's indicative of some of the saturation we're seeing market wide.
And Jesse, that would normally in a non-COVID time be under an hour.
Around an hour, correct. Obviously, clinicians sensitive to the golden hour with moving patients and the time metrics associated with that.
And essentially what you're saying here is that while this is a COVID problem, that it's affecting a lot of non-COVID diagnosis as well. So the people that may be undergoing a heart attack or a stroke or septic, they're experiencing the same weight and problems with finding placement as anyone else. So I think working together, we're able to pull from all the resources we can and be able to place patients as fast as possible. We know there are some protracted wait times out in the smaller hospitals, and we're offering the ability to help with management of that patients as well, so that while they're managing very complex patients in resource-strapped facilities, they still have the ability to access consultation and be able to treat the patients while the transports and everything else are being arranged.
And on this call in particular, last week, we heard from just a wonderful doctor in Lyons who was sharing a story about a patient that it took many, many hours to find a bed for and get them to Topeka. And the reason we highlight this, folks, for you is, as people's severity increases, they need more tools and more specialty. And, the larger hospitals and larger metros have more tools and more specialty. And so the transfer situation, these metrics that Dr. Watson is showing us today and will be sharing with us in the weeks to come, really help us see where the cracks are starting to form as far as the healthcare system goes, because it not only impacts COVID patients, as you point out, it's also the non-COVID patients. And with that, we're getting close to the end. Is there anything else you wanted to add, Dr. Watson or Jesse, to this presentation?
Yeah, no, I really do think we're at a place where, while it seems like there's a little breathing room, we're really much more fragile than anyone would anticipate. We're much too comfortable with how close we are to no capacity at times. And I really encourage everybody to stay the course and to continue what we're doing.
Thank you. And Seth, Dee Dee, Dr. Antonios, anything you'd want to add here before we wrap up the call?
No, from my perspective, thank you very much for listening today. And I want to wish everybody a happy holiday. Merry Christmas.
Yeah, we wish everybody a happy holiday. Again, these calls will be the same time every week. South Central report out is at 1:30. And again, you can sign up to get an email with the dashboard. We appreciate everybody for participating on this call. Wish you all a happy holiday. The vaccine is a great hope and a high bright spot for most of the people in the system that had chances. First time they feel like there's something offensive they can do against COVID versus being reactive. And so we're cheering you all on and grateful for the example you're setting for us. And clearly what we've seen in last week's call and this week's call, what we choose to do individually impacts our communities. And now as we've look like we may be seeing a plateau, it's important to keep that pedal down, that we continue to take care and do the little things individually to care for our communities. But we'll be watching the numbers closely. Bright spot really quick for this region, catching people doing something right. A group of high school students in Great Bend is creating a public service campaign focused on helping teenagers make better public health choices to slow the spread. Love seeing that. And then a group of prominent men in the Black community of Wichita is launching a social media awareness campaign to help spread commitment for public health behaviors. Just grateful for people leaning in, taking action, and just doing what they can. So wish you all a happy holiday. Thanks for joining us today, and we'll see you this time next week. Thank you very much.
Buddy.